Hi, I'm Dr. Janaki, working at Proment Hospital in Chennai.
Hello everyone, I'm Dr. Siddhika. I'm a consultant psychiatrist in Chennai.
So often we get these questions as psychiatrists from everyone saying that, what kind of age groups do you treat? What kind of conditions do you treat? Do old people need psychiatrists? Do younger children and, women, do they need psychiatrists in special conditions? So we thought that today we'll address these questions.
Yes, Dr. Janaki. So actually, I think the COVID pandemic has kind of told everyone that starting off with the children and adolescents, it is very important to pay attention to their mental and emotional health. With children not being in school, and we realize that interacting with other children and going to school not only gives them a kind of routine and academic development, but also their social development and communication skills, they improve going to school. So being at home, even among adolescents, we've seen a problem with internet addiction, social media addiction. So even though the internet has been a absolute boon during the pandemic, but still these are some problems that we come across. One of the things that people often tell me is, how do you diagnose emotional problems in children? So can you shed some light on that?
Right. So, as we know that children's mental makeup is very different from that of adults, and children have a different way of expressing things. So often we will not be able to get the symptoms verbally out of the children. So asking them questions like, "Are you depressed? Are you sad?" That might not make sense. But many times the child psychiatrist will see that the child is depressed through their play, the way they play, the way they express themselves in the family, how they draw. So through play therapy, through art therapy, the child psychiatrists and psychologists are able to understand what's happening with the child and also treat conditions in children. And often I think it is more, more about the behavior of the child. How does a child behave? Is there a sudden change in the behavior from before? Is the child not as expressive as before, not talking as much as before? These are indicators that the child may be undergoing some kind of depression. Is a child refusing to go to school? That's a very, I mean, of course right now, refusal, there is even refusal to attend online classes. So this is an indication of anxiety. It could be an indication of performance anxiety. And then children not wanting to go into social situations. So that is an indication of social anxiety. Similarly, there are some specific conditions that are diagnosed in childhood, like ADHD and attention deficit hyperactivity disorder, and also autism spectrum disorders. Would you like to talk a little bit about that, Dr. Siddhika?
Yeah, so in attention deficit hyperactivity disorder, sometimes parents also diagnose their children after reading something online, and then they come to us asking if their child has a ADHD. Sometimes the teachers may notice that the child is hyperactive or being disruptive in the class, or disturbing other students. Sometimes the child talks out of turn, and then they tell the parents that, please get the child evaluated, because he is not able to sit still in the class. He is not able to concentrate and focus. And now with online classes, children find it very difficult to focus on a screen throughout the day. So then that also becomes a problem that parents often ask: how do we improve concentration in a child? They are not sitting for their studies, they are not focusing on what they're supposed to be doing, they get distracted easily, they want to watch videos online, or they want to play games, but they are not able to focus on their studies. So these are the problems that we do encounter with Autism is basically like a developmental disorder, and sometimes it is noticed when the child is 1 to 2 years of age. Sometimes it is noticed a little bit later, and again with the autism, the main problems that we have are disturbances in non-verbal communication. That is, a child may not be able to maintain eye-to-eye contact while talking. The child may not be able to play with other children his or her age, and the child may have some kind of repetitive behaviors or obsessive symptoms which may be present. So a child may keep moving his hands in a particular way, or may keep asking for particular shiny objects, or want something in his hand all the time, something like
Yeah.
that. So these kind of behavior changes, that when the parents notice, then they take the child to a pediatrician, and the
Mm.
pediatrician may refer the child to us for further evaluation. So
Right.
also people ask, how acceptable is it, like, to have for a child to go to a psychiatrist, and if the child needs medication or therapy, does it
Mm.
affect the child later on in life? So
Mm.
what do you think? um,
Yeah.
how can we deal with that?
Yeah, I mean, this is such an important, question to address, because the stigma in adults is so huge in a country like ours. But for children, it is manyfold. That many times parents really fear the word psychiatrists and psychologists when it comes to their children, which is understandable. Like you can understand their point of view, but in conditions like ADHD and in conditions like depression and anxiety, if the child is not treated, if the adolescent is not treated on time, right, is not diagnosed, then it can have far-reaching effects in their life, their productivity, their growth, a social growth, everything can be hampered. So especially with ADHD, if the child is seen diagnosed early and treated early, then it can make a massive change. We have really good medications for ADHD. We have occupational therapy and psychological treatments for ADHD, for autism. I mean, for autism, we have ways to help the child fit in with the other children, to become more socially expressive. So there are therapies that can be used to help the child in that area. So why it is so important to address those issues in childhood is because it's the starting phase. It's like when you are watering, when you are growing a plant in your garden, right, and you put a seed and you need to water it, right, and you need to make sure there is sunshine and oxygen and everything for the for the seed, so that it grows into a strong tree, sapling, and then tree. So that's exactly what we want to do with our children. So if there is something wrong, if we address it at that point, then the child can still be nurtured and can still grow into a strong individual and a productive individual in the society. So that's why it is more important.
Yeah, I think, with the focus being that in our society, we do have 10th standard exams, 12th standard exams, competitive entrance exams, and all these are, milestones that the child has to achieve. And so if the child is suffering from deficits in concentration or behavior problems at these ages, then basically their productivity also is not good. So even seeing it from that point of view, getting treatment actually helps them be more productive at this crucial stage in life. And one more thing, one more point I feel is that when a child has behavior problems, also sometimes it can be corrected when parents change the way they communicate and they behave with the child. Sometimes if parents are fighting in front of children, or parents are not modeling the correct kind of behavior, then the child may
Mm.
also exhibit some problems. So parents bringing in their children also means that parents have to be receptive for changes in themselves as well, which is a very
Absolutely.
important
Yeah.
point.
Mm. Yeah.
So
So that's a very important point, that when you're dealing with the child, it's not the child alone, it's the family that you're dealing with. So I mean, yeah. So then if we move on to the next, so this is very briefly about children. Then we move on to adolescents. So what kind of issues do you see with adolescents in your practice?
So, the adolescent stage is basically between childhood and adulthood. So, it's like a transition phase where an adolescent is no longer a child, and so the adolescent wants as much freedom as an adult, but at the same time, the adolescent is not ready to take the responsibility of an adult. So, it's a kind of tug of war between wanting the freedom versus the parents wanting the adolescent to give that much of responsibility or to take that much care of themselves. In adolescence, we do find that sometimes the adolescent doesn't always listen to the parent. So most of the time parents will come and tell us that, she used to be a very obedient child, she used to listen everything I'm saying, but now she wants to go out with her friends, or he wants to sleep very late at night, and they don't listen to us. So one thing is, of course, understanding that normal adolescence itself is a turbulent period where the adolescent child may not listen to the parents all the time, may exert their freedom, and may want to do different things. So this is a time when the generation gap is very obvious between the parent and the child. Now, of course, in this age, we have many parents who want to be friends with their children. So this is a crucial stage at which parents need to balance when they are friends with their children and when they are a strict parent with their children. And when you achieve that balance with good communication with the child, it can be very fruitful for the parent as well as the child. So during adolescence, which is 13 to 19 years of age, that's what we call as the teenage. We do find that there are teenagers who show depressive symptoms, who may start isolating themselves. They shut themselves in their room, they may not communicate with the family. They may also show, they may get very angry, sometimes show aggressive behavior. So some teenagers may be very anxious, they may not be very fearful of writing their exams, going to school, and they may feel the stress of everything onto them. So a lot of teenagers, they say, I'm so stressed, I have to complete all my projects on time, I have all my extracurricular activities and I don't know how to manage. So during this stage also, many times we feel that some of the disorders we see in the adult population probably start out in childhood and adolescence, and there may be small things, hints which the parents can notice at this stage. So during adolescence also we find that the person is building a personality of their own. So sometimes the beginning of personality disorders is seen at this stage. There
Yeah.
are teenagers who may be very distressed, who may be very anxious, they may not know how to express themselves, and sometimes they do also exhibit self-harm behavior
Yeah.
during this age, among boys and as well as girls, because their bodies are changing. Sometimes there is something what we call as body dysmorphic disorder, or body image issues, where the
Yeah.
child becomes very conscious of the way they look, and they may not like the changes in their body, and they start developing and concretizing their gender identity, and also their own self identity at this period. So this is a very crucial stage where we must parents and the child work together, and if it becomes difficult, they can always take the help of a psychiatrist or a psychologist, so
Mm.
that this period transitions smoothly.
Yeah. Mm. Right. So you talked about gender identity and sexuality. So this is adolescence is a very crucial period when children, the adolescent understands the need for the sexual growth, and also is often confused about what is his sexuality. Sometimes the sexuality may be what we call as heterosexual orientation, which is more acceptable in society. Sometimes it may be homosexual orientation, which is not that acceptable in society, which may lead to its own set of problems. That may lead to like identity crisis, and it may lead to problems accepting themselves and that may then lead to depression and anxiety and those kind of issues. Also, there is another category, of course, people can also be, gender fluid, or they can be sexuality. In terms of sexuality, they can be fluid, so bisexuality. And about gender identity issues, which starts probably early in childhood, but that becomes more prominent, and the need to express the gender and to conform to a particular gender becomes more prominent in adolescence. So many times we also see people with gender identity issues coming for treatment only in adolescent phase or even later in adult phase. So these kind of issues can also present. Then of course there's a huge increase in the number of teenagers who start using drugs of abuse. I mean, that has certainly increased in the last decade in India as well. And different forms of drugs have started being used. Like cannabis has become very common, more commonly known as weed. And the use of cannabis has become rampant in universities. Also, use of alcohol and cigarettes, nicotine, and other drugs also has increased tremendously. And also, there are new categories of drugs being added every year. So that's a big worry for the parents, especially when they enter. Now, the adolescence is also a period when they transition from school, where everything is very structured, and going into an unstructured environment in university, in college. And often they go away from home as well, to study in a different place, sometimes in a different country, in a different environment, without the social support of the family. So many times, what has been holding them together suddenly is taken away from them. The scaffolding is taken away, so they find themselves even more lost during the transition. And because of that, sometimes people get into the wrong kind of friendships, and rely on things like drugs at that to help them overcome the fears and the anxiety that they have, or sometimes just to fit into groups. So these are also issues that adolescents often come up with.
That's absolutely right.
With this, we conclude the first part, which is about child and adolescent mental health. Wait for the second part, which is an interesting session on the various psychiatric problems in women, men, and the elderly. Thank you.